Hi, I'm Doeun, a researcher at the Doeun, and I'm also the head clinician at Welcome Dental Clinic from South Korea. And my topic for today is about prosthetics. I'll discuss the prosthetic process and the steps of the system one by one. The prosthetic process is largely comprised of three steps: the scanning, the designing, and the milling or printing. Let's first go over the scanning step. This is the first step. First off, you need an intraoral scanner to do this digital restoration, all right? Now let's look at how this works. Let's compare it to the analog process. This here is the file that I used to use when I lectured on the analog impression taking process long ago. It's complicated and hard to explain in words. You have to take all these numerous steps. I used to divide the concept into the fixture level impression and the abutment level impression when I did my lectures back then. And all of these many steps, well, nowadays I just don't do this anymore. But a lot of people still do this stuff, right? Here is a photo of one of my cases back when I used to do the analog method. We do all these things, and then we take the impression with all that blood in the mouth. And after we take the final impression, if you look here on the left, it fits correctly on the model. But if you look on the right side, if we actually try it on, you can see that it does not fit correctly. In this situation, we would cut and do the thing, right? Here's the photo after 5 years. Okay, let's see the next case. Immediate loading wasn't possible, so I used a temporary implant and did it this way. Now let's see how the digital workflow goes in comparison. Digital prosthetics has the advantage of retrievability. If it's screw retained, we can remove it and try different things. And we can also duplicate. We can scan the original prosthetic and make a duplicate. Let's look at this case here. This was the initial situation. You can see that we would have to do a full mouth extraction, right? But before the extractions, we measure the vertical dimension. We do a full mouth implantation on the maxilla. And we plan to do immediate loading on the anterior portion. We used Doeun, and the procedure was done very accurately as planned. The sinus lift was also done on both sides. And also the mandible is planned to get immediate loading as well. There's a special 3D printing material that is provided, which can print these temporary crowns. So we used this to print the prosthetic and load it immediately. So here it is. On the right side, mandible, the teeth number 3, 4, and 5 have been getting orthodontic treatment, so they are crowded together a bit. But the orthodontic treatment was all complete at the time of this implant treatment. The osseointegration was complete, and this here is immediately before the final loading was to be done. The determination of the vertical dimension was done through the Lucia jig method. So now everything is matched, and including the posterior bite. They are all in the PMMA condition, and in the middle, we evaluate the progress. At this point, there is a process called pre-preparation scan, in which we digitally transfer the case data to the lab. This allows us to create a new prosthetic using the pre-existing shape of the oral cavity. If you see here, we just delete the part with the teeth, and we can do all of this in this step of the process. And in 3Shape, there is this mode we can go into called Real View Engine, where we can combine the scan with an image of the patient's face. And through this, we can readjust the occlusal frame and redo the provisional to give to the patient. This here is the image 6 months later, and you can see how precise the fit is through the radiograph image. This is the final prosthesis picture here. This is 1 year later, and you can see how well it is being maintained. The material used was the PMMA disc and 3D temporary crown material. Let's take a look at the software now. When you get into the software, you will see the word library come up a lot. You see here this shape. You can tell that this is part of a cat, right? Well, this is kind of how a library works. If we just have a portion of the image, we can come up with the rest of the image if we have the data of the full image. This is basically what the library means. The library for a prosthetic system means a collection of these full images on the computer. What Doeun system provides as a library is for its various prosthetic components, such as the H scan body, the CA, or custom abutment, Link, DA, which stands for digital abutment, and the stock abutment. This library of the components are used to match up the scan to the full component. And this is why the intraoral scan or digital impression becomes so important. The impression process is very important, as you see. As you see on the left, the scan body, CA, DA, and SA libraries are used exactly to pinpoint the location and position of the implant and get the fixture level impression. Let me explain each one through case examples. Let's see how the scan body is used to get the fixture impression. The H scan body looks like this. You just seat the H scan body onto the implant and take an intraoral scan. You can obtain the fixture level impression even with a portion of the scan body scanned. In this case too, we seat the scan body onto the lateral incisor implant and take the scan. And with this patient, we did some bone augmentation using two-stage surgery and rotational graft on the number 4 tooth. We used 3 H scan bodies to take the scan, and the tooth number 4 on the front was planned to get a custom abutment due to the insufficient alignment of the number 4 path. Just by doing the scan, we can use any abutment, a custom abutment or a stock abutment, such as used in the posterior. And this is the radiograph. Now, this is the second case. We can even take a scan with a custom abutment in place and obtain the impression. Now, let's go back and think about what we did when we used the analog method. How do we obtain the location of the subgingival margin? The impression does not come off easily, and there is excess cement, right? You can see here on the number 46 tooth that there is inflammation on the gingiva. You can see the excess cement on the x-ray here. And we proceeded to remove this excess cement, and the inflammation went away. Even when we do it this way, using zirconia and a supramargin, we see that it is not exact. Let's see how this is solved by going digital. We seat the custom abutment and take a scan of the custom abutment, and then we merge. If we do it this way, we can exactly locate where the margin is. And let's see how the merging is done. If we take a scan of the abutment itself, we can use the corresponding library to match the two scans together. This is an example of such a procedure. And if we do it digitally this way, we can obtain the margin precisely, even if the margin itself is submerged under the gingiva. We can get an exact position of the margin this way. Now let's think about how a custom abutment is milled. A little shaft is remained during the milling process. There could be a little margin of error in the data, and this shaft is purposely cut off afterwards. It would be nice if this thing fit exactly, but in reality, this is not always the case. And that's because this shaft changes over time. So this is the problem of discrepancy between the designed abutment and the actual product that we get. And a lot of times we end up with an abutment that is larger in size than the designed abutment. So one of the techniques used by the labs is to make a bigger retention surface area inside. But the downside to this is that the crown loses retention, and the patients come back to the clinic with this problem. And this is why Doeun has developed the digital abutment component. The digital abutment can be used to directly obtain the fixture level impression as well. Then we can design the desired prosthetic from that. The digital abutment is composed of molar, premolar, anterior designs, and we can select and use according to each case. Now, case example, we can seat the digital abutment and take the scan. And then the bite was registered, and then the matching. And you can see on the right the precise matching that happened. Then we design the crown and also position the screw hole. And you can see the exact fit here with no flaws. Now let's see some other cases. Let's see how it was done using digital abutments. We looked into basically how the digital abutments were designed is that research was done on countless teeth, and their morphology or shape was analyzed, and they took the average in shape of these different teeth and then created the abutments according to this data. For example, for the anterior digital abutments, we see that there are various designs for the cuff height and the post heights. And also the top portion of the abutment is a matted surface, so there is no need to put powder on it before scanning. Also, there is no jig to be used with this digital abutment. There is a holder for the abutment since it is very small in size. And so using this digital abutment is very convenient for scanning. The image in the middle here is when the scans are being matched, and the matching point of the abutment is on the top of it, so there is no need to scan the margin. So we can seat the abutment, and if we want to adjust and make some changes, we can just select a different size. So this is another big advantage of these digital abutments. With conventional custom abutments, if it does not fit correctly, then we have to throw it away, right? So that's a disadvantage of the conventional custom abutment. With this case, the area in question is the number 33 and 43 sites. And this here is the photo of operation day. And you can see the wing on this, right? The wing. This is what is used when we put on the provisional. And this here is used to lock the abutment in place. We take the scan again with the abutment seated. So we did the prosthetic restoration, as you can see here. And you can see the number 3 tooth on both sides. Let's see a case where custom abutments were used for the maxilla premolar regions. And we can estimate the size of the digital abutment while during the designing process. And we matched this correctly due to the top positioning, even with a subgingival margin. The margin was submerged, but you can see that it was precisely positioned digitally. So for me, I always do 2 scans. I always scan again with the abutment in place to fabricate the prosthetic. The scan was done again with the digital abutment in place to obtain the fixture level impression. And so later, if we wanted to change the abutment to a stock abutment, we can do that as well. The digital abutment is seated here. But then even if we then choose a stock abutment to scan, we can still get the fixture level impression. By the way, Doeun also has the library for their stock abutments as well. Some people call it the cemented abutment. You can see here again how the library is used to do the matching even when the margin is submerged. Now with stock abutments, they are so small that they're hard to hold, right? So I'd like to show you, this is what I use. I use the handle for the impression coping to hold the abutment. We make it so that the driver can be inserted inside. It was remodeled, then I seat it and take the scan. In order to get a precise scan, the surface of the abutment must be cleanly scanned. So it is useful to put something in the hole, such as a piece of cotton. Let's look at this patient's case. This is how they came in. We need to remove the existing crown here, right? But before we do that, we take a scan. Then, using the scan, we duplicate all the teeth and then make a provisional with milling or by 3D printer. We basically make a duplicate provisional. Then, on the day when the crown is to be removed, we go ahead and treat the ones that need endo all in one day. Then we use these materials to make the provisionals. This way, the patient is able to chew and eat throughout the entire treatment period. The downside is that the temporary crowns can break easily, and this is why we make these duplicates. I see this as a major advantage with digital restorations. We can have this insurance plan with the prosthetics, right, by using digital restoration. Let's move on to the next case. This case also, a lot of extractions need to be done, and you can see that there is a large cyst in the number 22-23 area. So the cyst is removed and bios grafting material is inserted. Then implants are placed in the mandible. We used digital abutments in this case. You can see here on the upper number 34 site that the digital abutment is not fully seated. And in a situation like this, we can use the abutment profile drill to take off some bone, and then the abutment can be fully seated in place. The abutment profile drills are designed so that the digital abutment can be perfectly seated. And on the other hand, the implantations were done 1 week after. And so we finished the surgeries over a period of 3 weeks, and you can see the first week photo and the 4th week photo here from right to left. Digital abutments also come with a plastic cap, like the one you see on the photos here. This is to protect from the sharp digital abutment shape, of course. Meanwhile, we treat the ones that need endodontic treatment and do other things like place PMMA and take the vertical dimension. And the final vertical dimension was made using the Gothic tracer. And this is a photo of the final prosthetic delivery. Of course, the digital abutment was used here. Oh, and in the maxilla, the implant was placed after the cyst inoculation. The vertical dimension was confirmed, and also the horizontal line was evaluated. And for the anterior maxilla, a disc was used and made there. This is the photo after 1 year and 6 months. You can see the nice healed bone there where the cyst used to be. This is 3 years post-op. We can confirm here that it is being maintained nicely with no bone loss. The prosthetic duplication method using the pre-existing crown was used here as well. What you see here on the anterior is the PMMA prosthetic. The PMMA is being used for the healing period. I think this is more convenient and more precise. I think we're definitely on a higher level now. Now let's look at this case. I like to take photos like this of the patient smiling, right? Compared to the photo on the left, at the beginning of the treatment, you can see the growth in the smile muscles here. And this was the initial situation, and we attempted immediate loading in this situation. We can see here that the occlusal plane is like slanted and unevenly slanted. Again here, we duplicated the prosthetic by scanning it. And then for the mandible, we did immediate implantation and immediate loading after extraction. And then after 2 months, we did the first prosthetic replacement. And for the lower right side, we did a provisional restoration. The panoramic radiograph looks a bit distorted because the patient's head was lifted a bit during the x-ray, but still, you can see that the occlusal plane was determined sufficiently. So that's it for my presentation. Thank you for your time, and I'll welcome any questions if you have. Thank you.